I'm Dr. Donna. I'm taking advantage of Helena, who's coming from London, to have a doctor-to-doctor talk about the 4 main cancer screening tests that you may want to know or you may already know.
So, hi, to introduce myself, I'm a doctor based in London, also Dr. Donna's daughter, that's the connection, and we're going to be having a chat doctor to doctor just now.
Good.
So, let's get started.
Let's talk about what would you say is the first cancer screening test?
So I guess it starts with young females, that's probably number 1, or anyone with a uterus needs to get cervical cancer screening. Is that right?
Exactly, so probably from the age of 21 to 25 upwards, and that's carried out by a cervical pap smear. And again, we are looking at tests that more and more that patients can do themselves and be in charge. The next stage, so you've got past 20, what should we be looking at then?
As a woman, probably next would be
Or
breast.
a man?
Okay, so colon probably comes a bit earlier because from about 40, if you're worried.
Or if you
maybe
have a family history, you may want to do screening even sooner.
Okay.
Family history, genetics.
And what does colon cancer screening look like here?
Well, there's the fecal occult blood, a stool test that you give in the pot, put a sample of the fecal material in and have it sent to the lab, testing for blood, ideally 3 times.
Yeah.
But a lot of people with a really strong family history, colonoscopy is still the gold standard.
Yeah, and I guess part of the reason for that is that the fecal occult blood test that you see kind of around a lot picks up any blood, so things like hemorrhoids, any sort of bleeding. If you're seeing blood essentially at any point, then that will pick up as, a positive, and that can cause worry essentially rather than just going ahead with the colonoscopy, right?
Yeah.
So that's sort of the positive and negative of both.
And the next one, I think we're all aware of prostate and prostate cancer. We've probably all had a male friend, a relative who's had prostate cancer. That's a very important cancer for men.
That's and that one you would sort of start off with a PSA test. And
the blood test, which is very easy to have.
Yeah.
And then later on, consider the rectal exam as well.
Yeah.
With that.
And if, say, a PSA came back as, it's a kind of a more nuanced test. If it came back negative, then you're okay.
That's
but
okay.
If it comes back positive, how would you go about dealing with that?
Well, if it comes back positive, I'm a general doctor, so I would probably refer a patient to a urologist to have further testing or look at trends, a rectal exam or an MRI.
Yeah, I could see, I know you usually probably go MRI, prostate at that point, and then if there's anything abnormal, then go ahead with the biopsy.
Yeah. The mammogram, age 40 plus?
Yes, I think
with ultrasound?
Yeah, plus or minus ultrasound. So it sort of would be decided by usually the breast team because it depends on like the consistency of the breast and things like that. And if there was any lesions picked up, then they would go ahead and usually even biopsy at the point that you're getting the mammogram. So it's a sort of 1-day test.
Oh, wow.
Yeah.
That's good. I know we've all had, I've had mammograms and it's so scary lying there thinking, I hope it's going to be normal, And it's great to compare a result with a previous result. That's very reassuring. Often, I've had it in the same place every year at the same kind of time of year.
Okay. So usually with mammograms you'd say once every year?
Once every year is good, at least once every 2 years. And of course for high-risk patients that they do have a family history, I really think a specialist consultation is important.
Yeah, that makes sense. And the other one that's kind of, I know we're hearing more about now is sort of lung cancer screening for people at risk of lung cancer.
Yeah.
Like, for example, people who have smoked for quite a while, And what sort of screening do they have here?
Well, you were telling me that it's good to have the low-dose CT even annually, and of course it's available here in every hospital in Thailand.
Yeah. So that's something that's kind of being brought in, well, everywhere essentially, that maybe annual screening with a low-dose CT scan is of use for people who have higher risk essentially.
Well, I think this is great. We're going to finish now. Helena's going to start her oncology training.
Well, hopefully upcoming
and
essentially.
Come back with more information in 6 months.
Yes. What we haven't spoken about, and we will continue to speak about at some point, is things like pancreatic, ovarian. But if you're worried, the most important thing with symptoms, this is all completely different essentially. If you have symptoms, come and see a doctor. That's the most important thing.
But we screen because you don't have symptoms.
Yeah, screening is all about not having symptoms and what you should be doing year in, year out, essentially.
Oh, well, thanks, Helena. Have a safe flight.
Thank you. All right, bye-bye. And these tests are all different. Oh, I'll pause this. Yeah.